Family planning. Before we begin, I would like for you guys to consider and think about what family planning means to you, what the words, how you would define it to yourself. Family planning. People's Family Health Services defines family planning as deciding the number and spacing of your children through the use of contraception. Family planning services can include well health exams, blood pressure, weight, lipids, and diabetes screenings, amongst other things, breast and testicular exams, STI screenings, birth control and natural family planning education, pregnancy testing with options counseling, HIV screenings, fertility awareness and education, counseling and resources for mental health, domestic violence, human trafficking, and child abuse screenings for minors. What family planning is not, it is not an abortion, which can be a common misconception of what family planning is. Where can you receive family planning services? Most of these that you see here, especially the first two, would include having insurance or possibly paying out of pocket. OBGYN and family and primary care services. Nowadays, with the Affordable Care Act, you have to have insurance. Some people have Medicaid, and it is also taking a lot longer for people to receive appointments. Family planning clinics, Planned Parenthood, and health departments, local health departments, typically serve lower income people. They also sometimes take Healthy Texas Women, which is a state program in Texas. They also will take forms of Medicaid, depending on the clinics that you have in your community. The importance of family planning, the good. Family planning is important to the health of a mother and her children. Family planning can help prevent and plan pregnancy. It can help you decide your reproductive life plan and your future. Family planning can provide sex education, including fertility and infertility awareness, physical health, and birth control. It is important for both men and women. It provides people with opportunities and choices for their future. It allows them to have options, especially if you are a teenager in high school who doesn't want to get pregnant so early, but is also being sexually active. Common misconceptions and myths, the bad and the ugly. Some people believe solely against contraception due to religious beliefs. For example, if you are Catholic, which I am, typically the Catholic religion does not believe in birth control. They are more into natural family planning. Family planning is killing a baby, can be a common misconception or a myth. Common stereotypes and negativity towards family planning. When somebody hears a story that they had a bad experience at a family planning clinic, this can cause other people to not want to go and seek services because of their negativity towards it or their negative thoughts towards family planning. Contraception protects against sexually transmitted diseases, which of course is not true unless you're using a condom, which in that case can prevent pregnancy and STDs. Contraceptives are dangerous to a woman's health, which is a common misconception. The picture here shows a map of the United States. I didn't use it for the medical costs of how much it costs the government towards unintended pregnancies, but I did want you to see the areas in which states experience higher unintended pregnancy rates and where family planning services and education are more needed. So if you're in any of these states, it's good to maybe keep this in mind. Family planning in the mental health profession. Many articles were found where it affected women with schizophrenia because they are at higher rates of sexual coercion, high sexual activity, and unwanted pregnancies. When you're at higher sexual activity, of course, you're at more risk for unintended pregnancies and you're at higher risk of exposure to STDs. In another article, Barson stated that publicly funded family planning clinics provide healthcare services to millions of women every year, including women at risk for depression. Unintended and planned pregnancies can cause postpartum depression. Sometimes women and men who seek these services at local family planning clinics who do not have insurance or Medicaid or any type of way of paying for services, they seek services at these local family planning clinics, and this is the only type of services that they are able to receive. So sometimes they are screened for depression, postpartum depression, and at that point it would be up to the provider at the clinic to refer them out or to seek what services that they would need from there. What can we do as professionals? It is important to educate our clients, provide your clients with resources and referrals to family planning clinics in your surrounding area, know your area and your resources, dispel common myths and misconceptions about modern contraceptives. Don't let them carry this false misinterpretation of what these modern contraceptives are. It's important to educate them. And if you're not sure on what the modern contraceptives are, maybe refer them out or give them information. Establish relationships with the family planning providers to facilitate exchange of expertise. Getting together with local family planning clinics if you're a mental health provider or any other type of profession, and creating linkages so that you guys could possibly refer to each other and provide resources and services to your clients. The future of family planning. The World Health Organization is actively seeking ways to educate and increase information available to people in their communities. Their primary focus is on low-income communities where family planning is less prevalent or available. Seen in different articles, it is more likely for somebody who is without insurance and in a low-income community to be more sexually active and have a higher unintended pregnancy rate. So I tried to focus a little bit more or give more information on the low-income community. However, I did include just general information as well. Further resources. The World Health Organization, your local family planning clinics, local health department, which also can include family planning services. Family Planning, a global handbook for providers, which included a bunch of information on types of counseling, effective counseling in family planning, and a bunch of information on the different types of methods. The Guttmacher.org, on that website you can see updated information in the United States and internationally. So it's beneficial because if you have anybody that's an international student or a client, you're able to see gain that information and knowledge without going in blindsided and not knowing what their rates are. And those are my references. Thank you.